The relationship between dietary cholesterol and a healthy diet has been a topic of ongoing discussion among scientists for over half a century. Here's a summary of the latest understanding. 1. Dietary cholesterol versus blood cholesterol. Dietary cholesterol is found in foods, while blood cholesterol, including HDL good and LDL bad, is a measure of heart health. A diet high in saturated fat can lead to high LDL cholesterol levels, increasing the risk of plaque buildup in arteries, which can lead to heart attack or stroke. 2. Sources of dietary cholesterol. Dietary cholesterol primarily comes from animal-based foods such as high-fat meat, eggs, butter, and full-fat dairy products. It is especially abundant in processed meats like sausages, burgers, and hot dogs, and can also be found in baked goods made with eggs, butter, or cream. 3. Current recommendations and guidelines. Current guidelines suggest keeping dietary cholesterol consumption as low as possible without compromising the nutritional adequacy of the diet. The focus has shifted from strict limitations on dietary cholesterol to emphasizing an overall healthy diet. It's more important to focus on limiting saturated fat, sugar, and sodium intake while increasing fiber consumption. 4. The role of saturated fats. Foods high in dietary cholesterol often also contain high levels of saturated fat. Saturated fats are the main dietary cause of high LDL cholesterol. Swapping saturated fats like butter, lard, and ghee for unsaturated fats such as olive oil, rapeseed oil, or sunflower oil can help maintain healthy cholesterol levels. 5. Eggs and shellfish. Eggs and shellfish are exceptions, as they are high in dietary cholesterol but not in saturated fat. Research suggests that dietary cholesterol, mainly from eggs, has a relatively small effect on serum LDL cholesterol and CVD risk compared to other diet and lifestyle factors. If LDL cholesterol levels are low, consuming a few eggs per week is considered tolerable, depending on the overall diet. 6. Individual variability. The effect of dietary cholesterol on blood cholesterol levels varies from person to person. About 15 to 25% of the population are hyperresponders, who experience a more significant increase in LDL cholesterol after consuming cholesterol-rich foods. However, even in hyperresponders, dietary cholesterol doesn't seem to increase the risk of heart disease because it typically increases the large LDL particles, not the small, dense LDL. 7. Key components of a heart-healthy diet. Fruits and vegetables. Aim for at least 5 portions a day. They contain both insoluble and soluble fiber, which may help reduce cholesterol levels. Fiber-rich foods. Oatmeal, oat bran, kidney beans, Brussels sprouts, apples, and pears contain soluble fiber, which reduces the absorption of cholesterol. Unsaturated fats. Replace saturated fats with unsaturated fats from sources like olive oil, rapeseed oil, sunflower oil, nuts, and seeds. Omega-3 fatty acids. Fatty fish, salmon, tuna, mackerel, herring, trout are high in omega-3 fatty acids, which can reduce triglycerides and the risk of blood clots. Nuts and seeds. Almonds, walnuts, flaxseed, and canola oil can improve blood cholesterol. Lean protein sources. Include peas, beans, lentils, fish, nuts, chicken, and lean red meat in your diet. 8. Lifestyle modifications. Regular exercise improves cholesterol levels and heart health. Weight management. Losing 5 to 10% of body weight can significantly reduce triglycerides, total cholesterol, and LDL cholesterol. Avoid smoking. Smoking lowers HDL cholesterol levels and increases the risk of plaque buildup in the. 9. Other factors to consider. Genetics. Some people are genetically predisposed to high blood cholesterol levels. Age. As people age, their risk increases, and their tolerance for less healthy foods can change. By focusing on an overall heart-healthy dietary pattern and lifestyle, most individuals can maintain healthy cholesterol levels and reduce their risk of heart disease.